Welcome to Tech Turks. Today I have Tito, who's one of the co-founders of Helium Health. Helium Health are into a lot of things to do with the health sector, but I think the main drive is to make it a much better place. But I'll allow Tito to explain to us. So Tito, welcome to Tech Turks, and thank you for coming on the show. And the first question is, what's Helium Health about, and how did it start, and where are you now?
Well, I could literally stay here forever answering that question, but let me try to be more concise. First of all, thank you so much for having me. For those that don't know, my name is Tito Ovia. I'm one of the co-founders of Helium Health, but my real job every day, I'm the head of public sector growth, which means that I'm in charge of making sure that our solutions are adopted in the public sector across, Pan-Africa. So very simply, that's what I do every day. Helium Health is a healthcare technology company, and our mission is to be able to accelerate Africa's healthcare sector using data and technology. We actually started the company in 2016. Where we really started, all we wanted to do was to be able to create a platform where, donor agencies, governments, hospitals could be able to log in and just get data about what was going on in the Nigerian healthcare system. That was it. So basically aggregating all the different healthcare data sources and putting it together onto one platform.
Can I ask a question? So I know you talked about, you engage with the public sector, but when you engage with the private sector, who are you actually talking to? Are you talking to the doctor? Are you talking to the administrator?
So for us to be able to actually get our foot in the door, for private sector, we actually go directly straight to the owner of the hospital or the clinical director, right? Once we sort of get their buy-in, our normal standard process is for us to do a user acceptance test. So what this means is that every single team head or department head has to actually test our solution and actually give us feedback and actually say the kinds of configurations they then want. Because again, we all know it doesn't matter whether the owner of the hospital or, the big guy on top that's paying says, okay, great, use it, but somebody at the front desk decides not to register any patients because they don't like the solution, then you're not going to go far. So for us, it's important, first of all, to make sure that the person who's actually going to pay for the solution actually likes and they buy into it, first of all, because they're actually even going to be the drivers of it. They're going to be the ones that will sit on everyone's neck and says, what's wrong with Helium? Why is it not working? And then it's even more important to now make sure that the actual users are happy. So we do a full-on user acceptance test that makes sure that end-to-end, that they've tested it and it works out for their process flows. Yeah.
Now, if you install or integrate this into a hospital that has 10 beds, for example, now, what would be the benefit for all the stakeholders?
So first of all, with the patients, it's just as simple as you don't have to wait 30 minutes for your file, 45 minutes for your file before you start receiving care. Everybody in Nigeria has been there, right? Where you walk into the hospital and like, oh, let me go find your file, and somebody disappears somewhere, to go for. So first of all, that, which is the first noticeable difference when you actually digitize a hospital, the decrease in wait time for a patient. But not only that, the continuation of care that we actually spoke about is a lot better. There's some statistic that, 90 or something or 80% of doctors can't read their own handwriting a year later, right? It's crazy. So again, being able to actually continue care for the doctors and actually be able to accurately treat a patient, right? So first of all, that's all benefits to the patient. Then for the actual, let's say the users, the everyday users, whether you're at the front desk, pharmacy lab, consultant, right? Again, you're making your job a whole lot easier, right? Because there is this process flow. There is sort of you receiving the patient's information in real time, you seeing who's on your queue and how long they've been waiting, so you can even prepare for different patients.
Do you do inventory management from
all of it? So again, if you think about any kind of anything that happens in the hospital, our solution covers it. We even integrate with accounting softwares like Sage and QuickBooks as well to then help you out with that. And then again, for the actual hospital owner, because what they care about is their money, right? And what's actually happening in the hospital. So something we do that we think is quite cool is, every week we actually send them updates and graphical updates about the financials and the clinical aspects about what's going on in the hospital. So your top diagnosis, top prescription, your revenue, whether it increases or decreases week on week, things like that. But they can also log into the platform from their mobile phone and actually see this information. And, if they decide they want to go for like research grants or things like that, they actually can get granular reports as well. So you can see the number of women over the age of 50 that had diabetes and, received a specific brand of medication, right? Things like that. You can see all the people that are owing you money. You can track your top paying HMOs, your least paying HMOs. So things like that helps you better plan as a facility when you use our EMR. And again, you literally find that you reduce your financial leakages. Like one of the hospitals that we first launched in, actually, within the first 6 months, I think it was about 10 million naira that they literally cut out from paper. Like just 10 million naira, like that saved.
So COVID, how has it impacted your business? Being a digital company, has it created more awareness, better appreciation for your type of business, and from which segment? From the customers, hospitals, or from the user side?
Yeah. So business has been booming. I can't even lie during this period. I think we're probably one of the few companies that has actually hired so many people during this time. I think we've even increased salaries. I think we've even gotten interns, just because first of all, as Helium Health, we're a remote first company, first of all, right? So even before COVID, we're the kind of company that we don't care where you are, whether you're on the moon, whether you're in Antarctica, as long as you get your work done, you're meeting your goals, whether it's growth goals or financial goals, whatever it is, as long as you're meeting your goals, we're fine.
Does the data you collect give your clients insights and also give you a view of what's happening, trends in the market, and how you can also help assist them?
So one of the things that we saw first, when we started looking at data and the numbers, is that hospital owners never know how many patients come to their facilities, which was interesting. So you can imagine, we're saying, okay, how many patients come to your hospital so we can give you a proper pricing for your per credit model. And some of them are saying, maybe I see about 70 patients a day, and it's really 300. And again, so first of all, just even that, and having a system in place that tells you the number of patients that come every single day, that's wild. And it then even drastically changes your operations and even the amount of hands that you need. The second one that then comes into play is that, with even seeing where their revenue comes from, right? So a lot of hospitals want to grow and expand, right? And they're not sure how, and maybe because their next door neighbor got a mammogram, they're like, me too, I'm gonna go get a mammogram, right? And a lot of hospitals have done that and end up not getting enough revenue from it and enough need from it, right? So again, what's the point of getting a mammogram if the majority of patients that come are male? So things like that and those kind of insights have actually allowed hospitals to be able to change their strategy and even change their business model. The goal for us is that, you come into Nigeria or in fact any other African country that Helium Health is in, and you want to set up a hospital, we can advise you on where to set up, advise on the kind of pricing, who you should target, the services you should offer. So again, you're then building up that healthcare system in the country, not just that there is a general practice health facility on every street corner when that's not what is needed in the market. So yeah.
Excellent. It's been great talking to you at Helium Health. We've learned a lot, and I think your company is one of the proofs that going digital is definitely the way to go, especially
thank you.
After COVID-19 era. So thank you very much for coming on Tech Turks, and we'll continue.
Thank you so much for having me. We should do this again. It went by so quickly. My goodness.